Welcome back. All of us go to doctors at some point, sometime or the other. Occasionally we'll see a physician in training. Whether it's a student, resident, or fellow, hands-on training is integral to the future of medicine. It may give you a little bit more TLC and focus that wouldn't have occurred at the average practice. Retina Associates of Kentucky works with the University of Kentucky in a joint fellowship program to help train future retina specialists. I had the opportunity to talk with Dr. Wood, founder of Retina Associates, on why education is an integral part of their practice, and with Dr. Lee, their current fellow, on how his training will help him with his future as a retina surgeon. It's a simple fact that doctors aren't born doctors. Becoming a board-certified physician requires years of training and dedication from college, medical school, residency, and finally fellowship training. Many doctors won't have a full-time paying job until their mid-30s. At Retina Associates, they have a long history of training future retina physicians.
Our fellowship program has been offered for 20 years. We offer this to fully trained, board-eligible ophthalmologists who are eligible to perform surgery and to see patients now, but even though they finish this extensive training, they join us for either a 1 or 2 year postgraduate fellowship training program, learning more about diseases and surgery of the retina, macula, and vitreous.
You may ask, what is a fellow, and what is the day like for a licensed physician in fellowship training?
So a fellow is someone who's completed their ophthalmology residency. So they've gone through 4 years of medical school, they've gone through 4 years of ophthalmology residency as well. So they're essentially a fully trained general ophthalmologist, and then they're doing additional subspecialty training to get more specific training in retinal diseases and retina surgery. My day as a fellow consists of coming to clinic or to the operating room, depending on what the day is composed of, assisting in surgery or assisting in the clinic, handling emergencies, helping patients with phone calls, questions that they have, sort of filling in a lot of gaps and acting as an extender and smoothing out the day for the physicians that I work with, because a lot of times there's other things that happen that necessarily they don't need to deal with, but are beyond the ability of some of the staff and need some more medical background, and so I'm able to fill in those gaps and help out where I need to.
As a physician myself, I often hear people complain about having to see a trainee in the emergency department, hospital, or clinic. What most people don't realize is that training provides several benefits for the patient and the physicians.
We enjoy teaching, we enjoy having the fellows, and the patients get exposed to different people examining them, asking them different questions, and we have a chance to explore many more differential diagnoses and current treatments and controversial areas than otherwise these patients would have an opportunity to be evaluated with. So this fellowship program really is beneficial to the patient and to the fellow and to us.
Fellowship training in retina surgery isn't for the slouch of the class. The fellowship process is incredibly competitive and reserved for some of the best medicine has to offer.
A couple places in the country that have a blend of a university practice as well as a private practice, and so the benefit here is you get a little bit of the private practice world, and you get to see a lot of patients, and then also see how a practice would function in that kind of private practice setting. You see some different diseases at the university as well as you do here, and I think the benefit is you really get to see both worlds, because we've been in the academic world for all of residency and medical school, and so to be able to see what real practice looks like in an actual environment of how you want to practice in the future, it's helpful to see that.
Next time you're at the office, hospital, or an ER and find out that someone is training as part of your care, realize that you're getting some of the best and most cutting-edge care from the future of medicine, and honestly, some of the educators that make it possible. More StantonMD coming right up.